The Ministry of Health and Welfare has announced that they will cut down the total number of working hours of Taiwan's resident doctors to 80 hours per week, down from 88. They're expecting the new schedule to take effect as early as August this year. However, some experts in the medical fields are worried that the new labor law, which mandates one fixed day off plus one flexible day off per week, is already stretching the personnel very thin, and a further reduction to the doctor's schedules might make it more difficult for the hospitals to cover all the patients.
Before performing a surgery, Dr. Cai Bojiang suddenly passed out due to a myocardial infarction. It was suspected that working 30 straight hours was the cause. He was eventually saved from a coma. However, his brain had suffered from prolonged hypoxia and sustained heavy damage. He woke up with an intelligence of a 6-year-old. In order to avoid similar incidences in the future, the Health and Welfare Ministry had decided to reduce the working hours to resident doctors to 80 hours per week, down from 88.
对于内外科来讲呢，过去的工时还是比较高的，但是呢，我想这个是要让这个工作时间能够改善，才能够吸引更多的住院医师投入这一些科别。
The Health and Welfare Ministry said that after lengthy discussions with doctors from different disciplines, they have decided to not only reduce the total weekly hours to 80 hours, they will also reduce the consecutive working hours to 28 hours, down from 32. The schedule change will also include a reduction of hours in the intensive care unit and emergency room to 13 hours, possibly stretched to 16 under special circumstances, and the doctors must receive compensation afterwards. However, the changes worry some medical professionals since the new labor law, which allows for one fixed day plus one flexible day off per week, had already stretched the hospital personnel very thin. They worry the new schedule will make it even more difficult to cover all patients. The Ministry of Health and Welfare responded to doubts, saying that there are currently enough doctors. Their working hours just need to be more appropriately distributed among different disciplines. The ministry is expecting the new schedule to take effect in August this year.